how are we setting up environments so that healthier choice is a little bit easier?
Welcome to Kuul Conversations, where I, Clare McSweeney, founder of Kuul Play, sit down with thought leaders, innovators, and change makers that are shaping children's physical activity, sport, and the future of our kids' health. And at the end, we'll see how they are positively impacting kids' activity habits and learn the valuable takeaways that can help us all, coaches, parents, teachers, and communities, unlock the potential of our kids through fun, movement, and play. Today's guest is Nick Buettner, Director of Blue Zones, who is responsible for leading its implementation in all of the Blue Zones communities across the United States. And we're going to explore the approach of how some of the nation's healthiest cities and communities tackles physical inactivity and health issues so people live healthier lives. And how did this come about? Well, Nick, together with his brother Dan, National Geographic, and a team of longevity researchers, explored the corners of the world where people lived longer and better lives. From this came the Blue Zones Project, a community-based approach to healthy living that positively impacts the health of more than 10 million people and that wholly transformed cities across the United States. Together with Adventist Health, they are building Blue Zones in cities nationwide, and Nick is leading the charge. Nick, welcome to the Kuul Play community. I'm really excited to sit down here with you today and chat about living healthy, active lives. I really know your work. You've really done some significant work impacting whole communities and their well-being. And so I thought that we would, today maybe help our listeners better understand the Blue Zones project model and what you and your team are trying to do.
Sounds good. I'm looking forward to the conversation.
Great stuff. So yeah, enlighten us. Tell us about the really impactful work that you've been doing with Blue Zones Project.
Sure. Blue Zones projects came out of actually the research that my brother Dan and I have done to the place in the world where people are living the longest life.
Right.
And through that work, it was about 10 years of research with demographers, epidemiologists, schools of public health, and physicians to find the 9 commonalities that flew through all the different regions. And now what we're doing is bringing those lessons to communities with the goal of how are we setting up environments so that healthier choice is a little bit easier.
Wow. I love what you're bringing up here about the environment piece, designing that environment and making that healthier choice easier. And is that for equitable access for everyone in the communities?
Yes, 100%. The way the model works, if it's done right, is, for example, you want to look at what's our built environment, what's the design of our streets, and the availability for us to be able to walk and bike. So as parents, especially youth focused with schools, aren't afraid to allow our kids to walk and bike, or to go naturally to parks and be able to play and get together with their friends, no matter what your socioeconomic status, to have these places where you can get together. But the other thing you want to look at, and this is just one example around transportation or built environment, is what's our access to be able to get to work, to be able to get to a grocery store, to buy healthy foods, and that availability. And how does the design of our community impact that?
Right. So your point being that the environment then greatly impacts our behaviors, our activity level, and can help nudge people and ourselves to be more active and to move more.
Right. So the model of Blue Zones is what we want to look at is if you look at traditional healthcare in America, what we focus on is acute care. Wait till somebody gets sick, which is a wonderful thing to do for those people that are sick. But if you're at risk and you don't have the disease yet or healthy, it doesn't do a lot for you. Now, what they've done is when you go get your physical, they might say, hey, you're pre-diabetic. You might want to go on a diet. You might want to start exercising. But the problem is it misses behavioral science.
Mm.
I know I shouldn't eat a Big Mac every day for lunch. I know I shouldn't smoke a cigarette. I know I shouldn't sit on a couch all day long. But the problem is we do it anyways because at the time we do that action, it doesn't kill us. It's called hyperbolic discounting. I can eat a Big Mac every day for 10 years and not die. But eventually that the risk of doing that catches up and all of a sudden you have diabetes or you have a disease that impacts not only your quantity of life, but your quality of life.
Right.
So what we know now is the people who you spend your time with, your family and your friends and their behaviors, the places where you work, live, play, and pray, and the design of those spaces, as well as the social norms and cultures in our communities, our policy, are greater impact of our well-being than even our relationship with a doctor. So if we can design an environment where that healthy choice is easier, then it's easier for us to be healthier.
Yes, that's amazing. And in our small piece of work, in terms of with schools and kids, we're seeing exactly that, in terms of how educators come back to us about how Cool Play engineers that positive, inclusive environment. And the movement experience for kids then nudges them towards moving and playing together in an equitable access. So that really resonates what you're saying. But you're
Right.
talking about magnifying and amplifying throughout all pillars across the community.
Well, and if you look at what came out of the blue zones, it's not just being able to walk.
Right.
It's not just healthy access to what are we eating, but it's also, do we have a sense of purpose, a reason to get up in the morning? And if we've identified that sense of purpose, do we also have techniques to be able to set up so we can live it out? Because what good is it to have a sense of purpose if you can't live it out?
Right.
In the blue zone communities, they have less stress. Stress that's linked to inflammation, that's linked to most age related diseases. So, how are we lowering our stress levels, creating less inflammation, whether you're an adult or a kid who's getting ready to take a test, in our schools? And then, lastly, tied to that is also our social. Our friends matter.
Mhm.
35 years ago, the average American had three best friends. That's now down to a friend and a half. And by
Wow.
the way, if you can tell me where to get that half a friend, I think it's Facebook or Twitter. The reality is, if you have less than three friends, you're defined as lonely, and the impact that that has is on your health is about the same as smoking 20 cigarettes a day.
Wow. Wow.
So I bring it up as not only as it's important to us to have those friends as adults, but one of the things that they're finding is in schools, people that have ACEs, adverse childhood experiences, the number one thing that helps support that is friends
Yes.
and that peer-to-peer relationships who you can talk to, where you can kind of work with them. So how are we setting up environments that are pro-social, that are pro-movement, that are pro-plant-based, and pro-purpose in our lives? And that's the areas that Blue Zones tries to focus on when we look at our community transformations.
That's amazing. So, what I'm hearing you say is that you have communities and you have people, and they're unique. And it's that interplay between the environment and how we perceive the environment and our well being that's important. And that can be different in different communities. And what Blue Zones does is really puts a system in place and helps people, communities to be able to apply those 9 principles that you're talking about. Am I understanding that right?
That's exactly right. And the other thing you want to do is, so right now, any community you go to, the need of those communities are different. Like you were saying earlier, the social economics. Some of them are different places when it comes to well-being. Some of them are a little bit more challenged, around well-being. What we want to do is to bring in the system change to it that's measurable. So we'll
Okay.
partner with Gallup to look to oversample the community to get a baseline. But I think more importantly, we also work with the community on what are the health outcomes that you want. For example, in one of our communities, it's lower rates of diabetes in the community.
Okay.
And now, if you start looking at what is all the assets in the community that's doing to fight that right now, and how are we breaking down those silos so that everyone's working together around a common goal? And that can conclude designing our streets so you're walking more, which impacts our obesity rates, for example. You can look at a stronger food systems where we're bringing together the partners in food to look at how are we working with our better access to good foods and better food skills that meet the culture of a community. Then I can work with school and food nutrition in schools, where in one of our communities, the obesity rate or pre-diabetic rate of our kids are about 48%. Now, if I can come in and say, great, let's work with our schools around food skills, around education, but also around food nutrition, tied to ideally scratch cooking in that. That again is targeting diabetes. And then if I can work with our work sites to create healthier cafeterias and healthier foods, and maybe it's working with the farmers in the community through the food system to do CNA, where they're bringing actual produce or farmers market at the work site, so you have that access. And then at an individual level, I'm creating bonds of people who don't know each other that are cooking together for the first time and exchanging recipes and sharing ideas, but also creating friends. Now, if you what you've done is you've broken down the silos, so everyone's working together, and it all adds up to collective impact that then starts reducing the rates of diabetes and improving well-being in a community. Now, that's just one example. We, in our work, we tend to choose probably about 10 different community indicators like that, and then work with the community. Not us, but the community is the one that develops that blueprint for transformation. And then we hire a local team to then wake up every day to support them.
Right. So you're that third party guide and facilitator in this whole process.
Yeah, I argue there's lots of different values to where Blue Zones comes in, but number one, it's the partnership with Gallup that allows us to measure and baseline.
Right.
So now if I can bring in Gallup, I know what the need is, and then I can design the interventions. The second thing is we have a framework. It's a community-led framework where we can partner with the community to break down those silos and to really make sure that that blueprint is going to have impact. The third thing is we bring IP. Like, we've worked with work sites leadership around the country to create an evidence-based menu around things that you can do in the work site, for example. And it's not me telling them what to do, but they can choose the things that they want linked to the outcomes they want as an organization. We train and certify a staff. But I think the other value is the Blue Zone story brings a brand that puts everything together, so that if I'm seeing it in my work site and then I go and I go to a grocery store and I'm seeing healthy Blue Zone tags around those things that are good, or a checkout lane. If I go to a restaurant, I'm seeing it on the menu. I'm seeing activities and media partners are posting stuff around Blue Zones. Now the community is starting to talk Blue Zones. They're starting to talk about wellness as they're doing their plans for the direction they want to go as a community. And it's not me saying this is what you do. Communities decide how to take it in partnership with us.
Yes. And so if there's somebody, is it somebody in a community? Is it someone that values that leads this charge, that champions it?
Yes, you need. So we're in 75 communities right now, and have had great impact. Whether it's improving reduction in claims cost inside of the largest employers, whether it's in one community reduction in childhood obesity by 55%, which again, to your point earlier, impacted test scores in a community. You're seeing the Gallup Wellbeing Index in all of our communities, and we put fees at risk that it's moving. In Fort Worth, Texas, they went from 180th to 31st in 4 years
Wow.
because you created this model of well-being that really impacted people's lives. Now we are invited in. This isn't. We don't go out to communities and try to solicit.
Right.
They invite us in, and based on that invitation, you need a champion that helps organize so that we can pull the community together to understand what is really the opportunity in the community to bring people together around that common vision, but also pull in the right funders. Because normally this work is done on the side of volunteers' desks, but we actually hire a local team from the community that wakes up every day to deploy that blueprint in partnership with the community. And that takes resources,
Wow.
commitment.
There's a huge collaboration piece in and it really is a collective impact model that you have here.
Yes. Yeah, it's breaking down the silos, and again,
Yeah.
if you think about it, if I'm that person in the middle, what you're doing is you're setting up an environment that however I'm interacting with my community, that healthier choice is easier. Whether it's with through my friends and people that are encouraging me or nudging or helping me find purpose or getting me to live it out through volunteering, for example. Whether it's when I go to work and the design of my work site,
Right.
whether it's the checkout lane in a grocery store. What's the last thing you see in a grocery store? Is it a healthy choice? But if I can design that to be healthier with local products, if I can look at the restaurants I go to or through my faith and the design of that space or the design of my community around creating streets where you're not afraid to allow your kids to walk and bike,
Right.
where
Right.
parks are activated, healthier food systems, where those things that drive addiction like tobacco or alcohol are easier for us to quit and harder for kids to start. So me as the center now, however I'm interacting with that community, the healthier choice is just easier. And the
Yes.
last thing I'll say on that is that, people always say, oh, individual discipline and responsibility for
Right.
your actions. It's your fault. But the reality is if you go on a diet today, well, if 100 people go on a diet today, with inside of 3 months, so 10 of them would drop off. Down 7 months, only 10 would still be doing the diet. And after 2 years, virtually no one. So you're getting short-term success, but long-term failure. But if you can design an environment to support it, that's what really drives those outcomes.
That's incredible. That's incredible. It's reminding me of a report that the Aspen Institute Sports and Society program came out with in 2001. And they found that 44% of families reported that their community based kids' sports and activity programs had either closed, merged, or had limited capacity. And it feels like that, the model of Blue Zones with that, support system and structure in place, if that's valued within a community, that it's very helpful then to be able to address a situation like that.
Yeah, I mean, you look at so 50 years ago in America, you had about one-third the rate of obesity, about a seventh the rate of diabetes, and about a tenth, according to some studies, the rate of dementia.
Okay.
Now, why is that? Is it because they're smarter than we are now? No, it's the design of our communities. We went from having a few fast food restaurants to over 250,000 around the country.
Mhm.
You can't walk into a hardware store without having to go through a gauntlet of junk food. It's in our face. You look at social media, you turn it on. In Madison Avenue, they make billions of dollars selling us foods that's worse for us. Kids no longer, compared to 20, 30, 50 years ago, they no longer walk to school. Only about 10% of kids walk to school because of a fear of safety. Our parks aren't activated and invested in by our communities. They lay empty. There's no free range kids that are running around with their friends and just playing and being kids. It's more organized activities. I told you about the reality around our social friends. And the reality is, these days, I don't even have to go out to go to the grocery store. I can just sit on the couch and order everything from Amazon and
Right.
never have to leave or be engaged by a community. And that all impacts our well being. Those
Right.
impact our health. And if we can design our environments where, again, it's just a little bit more healthy around who we spend our time with, the place where we spend our time, and those social norms, it's just a little bit easier for us to
Yeah.
get. That's what we all want.
Absolutely. And you really you highlight a really key point is that our lifestyles through technology, through numerous things have just advancement of society have morphed very differently with consequences on our health. And you're taking a very preventative, value-based, upstream approach to redesign that more appropriately to help us cope with those changes and make that easier choice, maybe as easy as maybe 50 years ago.
That's it. Yeah, no, ideally that's it. And again, Digital isn't going anywhere. You know,
Right.
the work that you're doing, Claire, is amazing. It's an incredible tool for families. It's an incredible tool for individuals and schools. You know, but where's that analog connection as well? And how do you pair that digital to be created? Because I apologize, I just don't think friends are Facebook or Instagram or Twitter. They're not those people that are loyal when you're having a bad day.
No.
You know,
No.
so how do we become more engaged and supporting well-being, and again, not just our physical health but our mental health? You know, if you look at what's happened to our mental health over the last just 3 years with COVID in this country,
Right.
you know, what are those solutions and how do our friends impact and support that in ways that ideally keep us away from Adderall?
I couldn't agree more that humans are wired. We're wired, neurobiologically for connection. And,
Yeah, yeah.
it's just so important. And Cool Play tries with that to leverage the technology. So meet them at the screen and then push them off. And we see that with the kids when they move away from the screen and they're playing, and especially in nature and outdoors. I think it's, post COVID from being indoors so much, it changes their whole physiology. And then that mental impact, mental well-being impact is huge, so yeah, I couldn't agree more in terms of
And it
that.
impacts test scores.
Yes,
Kids that are
academic.
healthier are also getting better test scores and healthier nutritionally, healthier movement wise, healthier socially, and healthier mentally.
The ripple effect is unbelievable, and that's what's nice about the Blue Zones model is you really look at well-being as the whole package in terms of those 9 key pillars. And you talked about how the effects are interwoven and how it just spreads through the community. And I just wonder if we could zoom out for a second and say, this is, what is one key takeaway that maybe you'd have for members of a community? It could be parents, educators, adults, that they would leave this conversation with. What might be a key takeaway? Because there's so much here, and yeah.
But when I look at us as individuals, what I think of is a couple things. We have 9 commonalities that I shared with you earlier. Those come from the places in the world where people are living the longest life, right?
Yeah.
And tied to that, what I would think about is to try to do them all. I think is a recipe for disaster.
Okay.
So how do you first identify what are those things that you really want to work on? Like we have on our website a vitality compass is what we call it, or true happiness test is another tool. And there's tools all over the web, but you can go down and in 3 minutes identify where are those areas that you might want to work on.
Right.
And then what I say is focus on one or two. Don't try to focus on them all because it's a recipe for disaster. And instead of using individual discipline, think about how environment and design supports it. So if it's healthy eating, what's on your counter in your kitchen? Is it a big, bags of chips,
Right.
or is it a bowl of fruit? So when you want that impulse, what's in your eye, and what's in your refrigerator at eye level,
Right.
as you look at it, and when you look at sodas and stuff like that, get them out of the house. Now you're not tempted to have 4 or 5 of them during the day.
Yes.
And then find good friends
Mm.
that are like-minded. But how do you find those friends that can support you not only on that journey that you're going on, but also support you when you're having that bad day, where you
Right.
can pick up the call phone and they'll answer the phone and listen to you. I think that's the other thing. So again, don't try to do too much. Focus on what you want. You leverage environmental tools and system approaches to set it up, and find a good friend to support you in the journey.
Mm. Though that's pure gold, and really tangible for people to take away with, in their and impact sustainably into their everyday lives. Nick, you've decades of experience here, and you're impacting communities nationwide. From your perspective, do you think that the future is bright for our kids, the next generation? Like, what are you excited about, or are you excited?
I don't know. I don't know. One way or the other. There are things, and this is a personal. This isn't Blue Zones. This isn't research, and this is just
Sure.
me.
Sure.
But when I look at what's being presented to us as individuals, whether it's through the news or through what we're looking at on social media, it's biased. They're all trying to sell us something that isn't actual, whether it's fear or whether it's news here around we're going to get 3 feet of snow here in Minnesota when we got 10 inches, or social media has algorithms that are looking at your searches and they're looking at what and they're pushing things that they believe you want. It's not organic content. And I think that to me, that creates some examples of where we're taking each when large businesses and Madison Avenues are trying to sell us those things that aren't necessarily good for us, or the divisiveness that we have in our country, where we have real problems, but we're not willing to work together around those solutions. And I believe if we can work together around solutions that really matter to us as a community, and we can change the world. But it has to start with more trust, and it has to start with really coming together with our neighbors, with different people of different um, um, ethnic, different genders, different socioeconomic status, of different faiths, and coming together, all of us around common needs that we want, and work together to solve them, to use that collective impact model. And if that happens, I think we are in a very good place, because I think that there's nothing we can't do if we work together and
Incredible.
use evidence-based solutions.
Yes. And
Evidence-based solutions, not just do it because it feels right, but actual
backed by science,
science
just like
informed.
blue zones. Yeah.
Yeah.
And so what's your hope for industry leaders? What would be your hope, your wish for industry or sector leaders here?
So for me, I mean, the reality is for the sector leaders, I believe that they do have a responsibility to the stakeholders, not just the shareholders. But more importantly, I don't know. The reality is it's more of an understanding. If I'm a large organization, for example, it's not asking them to do anything altruistic, to be honest with you. Because as you look at their number one cost in that organization is claims cost of their employees. If their employees are sick and they're not coming to work, or the social relationships inside of that work site aren't positive, that impacts productivity. So there is economic value to well-being. When you look at our grocery stores, there's right now economic value to selling the things that are good, not only for the local fruits and those things that are good, there's value in it. We don't have to just sell processed foods. What the market wants is those healthier pieces. So there's value in that. So it's not so much altruistic. If I look at business downtowns and economics, it's very clear that if I can create a downtown that's walkable, it's better for a tax rate. Urban sprawl is incredibly expensive. Not only do you have to lay all the pipes and all the phone lines and everything around those human that sprawl, but the problem is in 10 years, if you don't have the density, or 20 years when you have to go fix that stuff, now the price of that's out of whack, and that impacts the costs of our cities. But it also, if I have a strong walkable community where people want to go downtown, business sales go up,
Yes.
which is
Yeah.
economic. So it's not, I believe everybody should do it because it's altruistic from business leaders. But I think at the end of the day, it's understanding the economics. It's good, smart economics. You
Yeah,
know it
that's
from you know it from schools, right? What's
yeah.
the value of health and wellness on student education, and absenteeism and behavioral issues and all of that other stuff that those kids are.
Massive, huge. And the best thing about the kids is, it's that window of opportunity where we can influence their behaviors and lifestyles positively for the rest of their lives, so it has that ripple effect. But you're right, there is absolutely economic value everywhere. The inclusion piece, and listening to everybody.
You have to. I mean, everybody has a voice in this, and they're needed. In one community that I went to, they wanted to put bicycle. The city wanted to put bicycle lanes, and they just started doing it in the community without engaging the residents of that community, which was they were socioeconomically impacted.
Yes.
It's one of those communities that had a low social economic, and they're like, we don't want bike lanes because they looked at bike lanes being tied to gentrification.
Mm.
And now all of a sudden they're going, well, wait a minute, you're going to just move me to another community and to another neighborhood. And there's historical reasons why. Now, is there value of those bike lanes? Oh my gosh, yes. But if you're not engaging those residents and listening to them and understanding what do they want and what are those needs and how are you aligning the needs to everybody who has a stake in that community, businesses, city leaders, individuals, faith-based partners,
Yes.
law enforcement. We're all coming together around that common solution. Again, I think we move the needle. But if we say, nope, this is our problem and we're the only ones that have a voice in this problem, you're not going to move the needle. You're just going to fight with the next group, you know?
Speaking of moving the needle, Nick, I mean, you and your team are doing the work that can really shift the dial to help communities live healthier lives. And the Blue Zones Project, what a great model for living well. Thank you. Thank you for sharing best practices, all science-based, and with extensive research over decades. And you talked about purpose, ideas, systems, models, and just enormous value. I really appreciate what you've built. Your team with the Blue Zones team, my engagements with you guys has been amazing. And so to spread the word further, where can people go to find out more about Blue Zones Project?
The best place to go is bluezones.com
Great.
or follow us on Instagram or Twitter. Blue Zones is the best. And just to be clear, I'm one person that's part of a really brilliant team
Mhm.
of people that have expertise in different sectors and different areas. And that's how this gets done, is bringing in people that are way smarter than me to be able to help develop a model
Well,
that is
Well, Nick, you're leading the charge, and you're all experts. I mean, it's incredible. Your team are phenomenal, and it is amazing the work you've done and you continue to do. So folks can check you out on your website and Instagram to learn more. Thank you so much for your time and sharing your ideas and thoughts about the future. And we'll take that optimistic approach, and together collectively we'll move the dial positively towards making it better for our future generations.
Thanks, Claire. I appreciate your time.
Thank you very much.